they thought they were losing me, and so the nurse is like hugging my mom and crying, and my mom's crying, and this vlog's kind of choppy because I've been too sick to record much, so I'm having to elaborate in between the little snippets. Recovery has been rough. My labs keep taking a dump on me. Now it's phosphate, right?
The big IV.
The phosphate that they're supplementing
do I have to put a big IV
is not compatible with anything for here, and we're about to start TPN with this.
I'd rather use something
Lumen,
small.
and then that's my Benadryl, of course. So we have to try to get a nice second IV. And my veins have been poked so much that they're done. They're just done.
All right, ready?
Ready.
Okay, here I go. I'm gonna try it right here. She's gonna get
This
it.
is the...
She's on her game. You rock.
Woo!
Hence why you're the IV team, right?
Yeah.
I got it. Thank you.
You look relieved.
Yes. It's always stressful when you have to do something like this. Okay, Shani, do you have anything else? Because I need to go.
Okay, but I forgot what I'm saying.
Looks great. And you were talking about putting betadine or that kind of stuff on our alcohol. Mm-hmm. So that's usually it's pretty much always not recommended because it actually delays healing of the wound. So usually the most we'll do is soapy water or saline. Typically just saline.
So that open spot's the belly button?
Yep, and it's not open. It's you just got the belly button and it kind of curves around it. So there's no dehiscence, which is where they split in between. So that's a good sign. But yeah, this all looks great.
Originally, the surgeon was supposed to go in laparoscopically or do a smaller incision, but upon going in, as soon as he cut me open, what they told my family was that my intestines literally all just popped out of my body because they were so dilated and distended and needed out. And he said that they were so loose and lax for my Ehlers Danlos Syndrome. So that's why they had to do the 7-inch incision. After I had seen my incision for the first time, I cried. About 2 days post-op, I developed a 102-degree fever, and the pain that had originally brought me into the hospital was back. And my white count, which was 12 when I went into the ER, but had crashed to a 3 after surgery, was increasing a little bit. And we knew whether a drop or an increase in WBC was indicative of an infection along with my fever. So they put me on antibiotics and drew blood cultures. I was only able to do a couple doses of my antibiotic because I started getting very ill upon each administration. They had me on 3 different antibiotics, each 2 times a day. I was taking Zyvox, tobramycin, and Rocephin, which have been my safe antibiotics. But each time I would get really sick. It almost felt like before you go under anesthesia and you start feeling like you can't breathe as well and you're all lightheaded and loopy, and then on top of that I was feeling like what I get preceding a reaction, I get this weird feeling, and that was happening each medication. I was on a fentanyl PCA IV, and apparently what the problem was that I was reacting to the fentanyl, and when they would go to push in a medication, it would send almost a faster dose of fentanyl into my system than what my mast cells wanted, and I started going into seizures from it, amongst other reaction symptoms, and I desatted. It was just a mess. That kept happening over and over and over again once it finally built up in my system enough to where I was having the seizures. So we tried to wean down on my fentanyl PCA, and I discontinued the antibiotics, but I had had enough of the antibiotics that my fever was down. This is my first stand-up since surgery on Friday with my cankles.
She has got some cankles. She can hide a hamburger under there. Oh my goodness, Shy. Because she's cool like that.
Oh gosh, my legs aren't going to work.
Hey, I gotta go.
I finally was able to stand up. They had PT, and I walked around the room. And after that, I started spiking a low-grade fever, but nothing concerning, and but my pain just kept escalating. And then by that evening, I kept telling my mother I didn't feel right, that something was wrong. My vitals were starting to look off. I was tachycardic. The fever was increasing, but it was still low-grade 99s. So I went to bed, and I woke up at 3 a.m. and in the worst pain I had ever been in my life. And it was very similar to the pain that brought me into the emergency room. But it's the same pain that I had had a billion times before. That from my ileus and my lack of small bowel function and colon, but now I don't have that anymore. But there was like a little bit different component to it too. The nurse paged the doctor, and the doctor came in and said how good I looked and asked when I was going home. Then the nurse paged him again a couple hours later as I progressed, and then his whole demeanor had changed. He ordered Dilaudid, but because I was screaming in pain, and I'm not a screamer, I do not scream. But Dilaudid is on shortage. But we knew they couldn't give me fentanyl because I was having seizures to fentanyl. So they managed to get a special request from pharmacy, and they had one bottle of Dilaudid hidden away for an emergency. But I ended up getting that one bottle of Dilaudid, and pharmacy hand-delivered it to this floor. But once my nurse got it in his hands, he could no longer administer it to me because my blood pressure was just dropping. And I was just screaming, and then all of a sudden, like, my blood pressure just kept dropping and dropping and dropping, and I didn't even know what was wrong. I was practically delirious, and all these nurses were hovering over me. They were checking my arterial blood gases. They were running lactate, trying to figure out if I was septic, because we figured I kept saying there was I had an infection, because I knew I didn't feel right. They couldn't get access on me, and all of a sudden, like, my vitals are going down, and another nurse comes in and is, like, asking my mom, like, what in the world is happening, and my mom's, like, pointing to the monitor, because they thought they were losing me, and so the nurse is, like, hugging my mom and crying, and my mom's crying, and then they call Solino down to pretty much say goodbye in case something were to happen. But I couldn't really talk. I was like, they were saying like how pale I was, and my blood counts crashed. They were about to transfuse me. I never got my pain meds because of my blood pressure. They managed to get my blood pressure up a little bit with a huge bolus of fluids. This overwhelming, like, peace came over me, where, like, all of a sudden, where they say, like, the body can only handle so much pain, and, like, when you're about to die, and, like, everything, like, just becomes peaceful. Well, that happened, and all of a sudden, everything didn't feel as bad anymore, and the pain decreased tremendously. And my parents said I was mumbling to someone in the corner. So then the doctors and nurses are rushing me to CT because they thought maybe I could have a leak.
Yeah, I gotta make some phone calls.
Then the CT came back, and I still had fluid in my abdomen, but nothing, like, concerning to the point where they need to open me back up for surgery, so we knew that likely wasn't it either. And so the surgeon had said that I was in hypovolemic shock from third spacing my fluids after surgery, and I was not receiving enough because the nurse I was only receiving like 4 extra hours of IV fluids after my TPN, but we had withheld one night before because I was having pitting from the edema in my feet, and the nurse didn't between like me and the nurse, we thought that I didn't need any more fluid since I was holding on to them. Not having a colon, your colon's what absorbs most of your water in your body, and I didn't have that anymore. So my body was just in a whole state of disarray. And so they gave me tons of extra fluids, and every time they would shut off my fluids, even for a few minutes, I would start to have problems again. But finally, one night, I don't know how to word this, but I went to the restroom and there was my intestine lining. The nurse, who was an older nurse, had been nursing for years, had never seen such a thing, and she was very concerned, and she paged the doctor, and the next morning the surgeon had come in and said to test me for Cdiff. But he said it's probably not, because I hardly have a colon, I only have a couple inches, but I guess that was indicative of Cdiff. Another nurse had asked him, why am I ordering a Cdiff test when this girl doesn't hardly have a colon? And he just said, because I told you so. So she humored him and ordered the test, and a few hours later it was positive. And we were not expecting that, so that's why I practically shat out my intestinal lining. And that's another factor as to why I went into hypovolemic shock, because I was getting even more dehydrated from the lack of fluids and the third spacing and my mast cell problems and the C. diff infection. Then with the C. diff, there poses the problem of treatment, because of course mast cells don't like those kinds of drugs. And I had 4 options. So Vanc is a known mast cell degranulator, but when it's taken orally, it doesn't go to the bloodstream, so it doesn't get absorbed systemically, and if it does, it's very little. So they were saying that it shouldn't be a problem mast cell-wise if it's not absorbed systemically, but I just had a gut feeling that that was not the correct decision. I mean, you can go in and biopsy my GI tract, and I do have an increased number of mast cells, so when the mast cells in your gastrointestinal tract are coming in contact with that mast cell degranulator, you best believe there's going to be some sort of mast cell degranulation. But everyone was trying to convince me that the vancomycin was the correct decision. And I emailed Dr. Afrin, and thankfully he emailed back just in time.
And this is what he said. Gotta put on my glasses so I can see. He says, "Dear Miss Perry, again, I am so sorry to hear of your ongoing challenges. Vancomycin is a trigger of mast cell activation. If there is the option to use another antibiotic principally used to combat C. diff, and especially if you already know you react to vancomycin, then Flagyl would probably be the better choice IV. But there's also another antibiotic called Fidoximus and whatever, it's the Defcid, that's been approved to treat C. diff, but it is much more expensive." So that's where we went, was with that one.
It's Difficid.
Difficid, that's the name of it, Difficid, but it's very, very, very expensive.
Or it's also called
And so you have to have ID's approval to just give it.
Beta-codemycin.
They will crush it up. They will use her sterile water that she uses to make med, or her feeds, and it'll come in about 12.5 mils, and she'll do it twice a day for 10 days. That was the least. If we did the IV vancomycin, but reconstituted it oral to put through her gut, we'd have to do that 4 times a day. And
The other 2 options were also oral options, and it was either Flagyl or Difficid. And the problem with both of those is that they cannot be compounded, and they have excipient, filler, and preservative ingredients that can set me off mast cell wise. They have the IV Flagyl too, which was going to be our backup, but it has one of the inactive ingredients in the IV version of Flagyl is an alcohol-based buffer. I had a pretty bad encounter with a med with that buffer in it. I only got 8 mLs of the IV medication infused into me, and it was full-blown anaphylaxis. Like, I was gasping for air. My blood pressure was 199 over 100 and something. I couldn't breathe. We almost were calling 911 for that too.
is
I
not
just don't want to put any more
stove.
air than already is in there, you know?
Well,
Okay. But you need to keep the air in there so she can mix it up every little bit.
Okay,
Okay, it is-
2037. Let's. How about, would you take your temperature now?
yes,
You can
ma'am.
find it.
Oh, you're recording this?
Yeah,
We're trying.
we are
Deficit, I think.
hopefully being successful in this.
I'm just gonna take the pillow.
Oh, I like that pillowcase.
Oh, I so
She's so bad. And she's not a,
Seamstress.
yeah.
Are you not a Harry Potter fan?
Oh, I am. I'm just not a seamstress.
Yeah, we have the whole collection at home.
That's who she named her cat after. Do you like Harry Potter?
Yeah,
I'll
I
have
do.
to show you something.
On the last, when the last book came out, I had pre-ordered it, and I was here at work. I know, at my age. And bless
99.4.
his heart. What is it?
99.4.
Okay, thank you. My son
Okay,
went
go
and
away,
picked it up
Cindy.
for me at midnight, stood in line and picked it
Really?
up. He calls me and goes, "Okay, Mom, I got the book. Now what?" I said, "Okay, open up, turn to the last page and read it to me."
That's funny.
I wanted to find out who was alive at the end.
This is Cheyenne's cat. She named him Weasley
Oh,
because he's a redhead.
okay, that looks like Hermione's cat.
Let's see. That's her golden.
This is gonna be a long process.
But I'm just hoping it's not going to be too bad. Because antibiotics tear me up.
Well, I'm
This is
prepared.
an antifungal.
Well, I can't do much worse to your
What?
poop right now.
What classification of medication is this?
I'd have to look it up, but I believe it's an antifungal. If you do react to something, I know there's different stages of reaction, but how soon after you come in contact with it do you start to feel
It
anything?
depends on if it's oral or IV.
She's never been successful with oral. Cheyenne, what's going on?
I'm just getting my seizure auras. And my gut burns.
Really?
But so far the deficit has worked very well. I do feel better than I did. The Cdiff was kicking my butt. We were still both so surprised. I'm thankful so far that the reactions to the deficit have not progressed to the severity that they could have. We are pushing it over 3 hours through my J-tube with all the excipients. I didn't even realize that my surgery was 5 hours because he spent so long trying to avoid the ileostomy. The ileostomy is still a possibility on the table. It depends on how well the sutures hold inside and how my bowel dilates. Right now I am on TPN. I'm not so sure what the future holds as far as nutritionally. The TPN here has worked much better than TPN has in the past. If you're a long-term viewer, you'll know that my GI doctor has been trying to put me on TPN for months, and we had been trying like one component at a time, trying to find what ingredient had been setting me off. And I'm not sure what they did differently here, but it's worked and I'm thankful, and I hope that continues. During my surgery, they had to give me vasopressors. We had a surgeon or like an anesthesiology nurse come in to check on me to ask how I was because they had to give me vasopressors during surgery. Prior to surgery, when the anesthesiologist was coming up with my med concoctions, he said that they were going to try to find a preservative-free vasodepressor in case they had to use it, but it was likely that they wouldn't have to use it. He's like, unless your blood pressure is like 60/40, and he goes like this, like, you're not going to have to use it. But it turns out they did have to use it, and the person who told me said that they could not reveal all of the information, and I would have to request my medical records. That's been emotionally hard to handle, to know that that happened during surgery, plus the hypovolemic shock type similar incident after surgery. I realized like, God has everything happen for a reason, but this whole fiasco has been very traumatizing, and I'm definitely going to therapy. Let's just put it that way. I was not expecting to go to the emergency room to find the volvulus and have to have emergency surgery. I had been having problems with obstructions and ileus, chronic ileus for the last year, and we almost didn't go to the ER because it's like, what were they going to do? They weren't going to probably find anything any different than any other time. And so I just think, like, what if I didn't end up going? I mean, it took me like 12 hours to end up there, but they said within a few more hours I would have perforated, and I never knew how weak my body was until now. And it kind of all hits you at once, and you're not expecting it. Like when you can't even like get up to use a bathroom, or you can't even go in the bedpan, you can't wipe yourself, you can't do anything for yourself because you're just that sick. And I never experienced it to that level before. I definitely have an increased appreciation for family and nurses and stuff that love me enough to put up with that, because I've given them a run for their money over the last week. We were hoping to go home today, and it needs to happen soon because I need to wash my hair. But anyways, hopefully it'll be tomorrow or the next day. And thanks for watching.